All right, today I want to talk about how to save some money on healthcare, trying to give you a better understanding of how the difference between Medicare and Medicaid and some of the expenses that I was able to find for those, just to give you some top of line information. You're going to have to do some research to get all the information you need because everything changes based on incomes and states you live in and etc. So first off, let's talk about the difference between Medicare and Medicaid. And I'm going to read this right from the website. I took it and printed it out so that I would have a direct quote from them. Medicare is a federal health insurance for anyone over 65 and older, and some people under 65 that have certain disabilities and conditions. Medicaid is a joint federal and state program that gives health coverage to some people with limited income and resources. So, where you live matters when it comes to these resources and what you may pay for these different things. Okay? And that's where coming into information on the Medicaid and Medicare parts A, B, C, and D matter as well. So you're going to have to do some of your own research as well. I'm going to just go through brief information that I found and share it with you and give you some guidelines and resources to look for after this. Okay, so part A is it basically falls under Medicare, and that's the hospital insurance that you get, including inpatient care, skilled nursing facilities, and hospice. This is basically what the free plan is, even though it's not technically free, because even Medicare premiums, the standard is $185 a month for 2025. So you're going to pay something for it. And my understanding is you're automatically enrolled if you are in Social Security payments. If you're taking Social Security at 65, they automatically enroll you. And then, of course, if you have a pre-existing condition or something that may get you into Medicaid or Medicare sooner, you can apply for that and see if you could, if it counts, right? See if you qualify. All right, let's move on. Part B is medical insurance, including doctor visits, outpatient care, and some preventive services. That's different than obviously Part A. And this is where you start to add on. We all see those commercials every year, especially going into the end of the year about, check your zip code now to see if you qualify for better benefits on Medicare parts A, B, C, and D, etc. Well, that's because where you live does matter, okay? So Part C is called the Medicare Advantage, and that is a private insurance plan that offers the same coverage as Parts A and B and often include additional benefits like vision, dental, and hearing. And that would be one of the things that would depend on where you live, what state you're in. And then Part D is where you get into prescription drug coverage. And these things are important because, obviously, prescription drugs are expensive. One of the congestive heart medications I take is Entresto. They advertise it on TV. That stuff is $1,500 a month for my dosage if I didn't have good insurance. And with the manufacturer offers a copay of like $10 for the medicine up to a certain amount every year. So I don't typically have to pay really until the last 90-day refill. And then it ends up costing me out of pocket after my insurance $700 for a 3-month supply. So thankfully, the first 9 months of the year I pay $10, but without it, and when I move on into Social Security and get into Medicare or Medicaid, who knows what it's going to cost. But those medicines are very expensive. So everybody needs to be aware. And of course, there's lots of programs out there that you can qualify for to get cheap medications, RX medicine RX or RX medicine. I forget what it's called. We've used that before in the past before we got better insurance. So there are options out there to try. Now I'm just going to try to briefly go through what's left here because so apparently when you enroll for Medicare matters because there can be some kind of a lifetime fee or penalty that is assessed to you if you do not sign up during the proper enrollment times. So the way it seems to work is that, and on their website, they have a calculator so you can put in your date of birth and your age, all that stuff, and it'll calculate your window for application. Okay. And it's basically comes down to about 4 months before you turn 65, and then for a few months after you turn 65, is what your timeline is. So my timeline, my birthday is in October. My timeline was July 1st of the year I turned 65 until January 31st going into the next year. So it's about a 6-month window, give or take. Okay, and then if you go and miss any of those, miss your window, you could be assessed some kind of a lifetime fee or penalty. I could not find what that actually was on their website, but apparently there is one. So pay attention to that. Now, if you are currently enrolled at that time when you turn 65 in an employee covered health plan, whether through your personal, because you're still working, or your spouse, then the date that you applied doesn't matter as much because you're covered. I think the big part that they want is to make sure that you don't have any lapse in coverage between employee health care and Medicare. And the final point of that too is that the yearly enrollment time is in November through January 31st. So make sure that you are at least going to get in that at that point, depending on when you're planning to retire or when you're going to be on want Medicare to kick in. Now, you also got to pay attention to your out-of-pocket expenses because they have yearly maximum deductibles, and it's almost $10,000, okay, per person. So it's not between you and your wife. It's, one. It's per person the way I understood it. So make sure you understand that. Also, understand the importance of having good health care and having good health preventative care, meaning taking care of yourself, eating right, getting some exercise, some movement every day. That can really, really save you a lot of money on costly health complications that can come up at any time. And most of the things that I see and that are reported are things linked to obesity, diabetes, and heart condition type things, right? Especially if you've had a heart attack or a stroke, or you are at risk. My heart condition was not caused by any of that. It was caused by an aneurysm. So my heart is generally not the issue. It's everything associated after the fact. I know that sounds kind of silly, but that's pretty much the fact of that. Now, I want to talk about some resources for support because there's a lot of good ones out there. First off, go to Medicare.gov. You can go in there and find out all kinds of information. Just search it. It's in there. The Centers for Medicare and Medicaid Services, also known as CMS. They have a website you can go to get information and to find help. And they have through one of these programs, they actually have a Medicare Medicaid guidebook PDF for free. And then, of course, you can go to Social Security Administration. They have a Medicare Savings Program, okay? There's a Patient Advocate Foundation out there. I believe it is state specific, but you go on their website and you can get some information on who to contact in your state to get help. And then there's a program called SHIP, which stands for the State Health Insurance Assistance Program. So if you're low income or lower income, you may qualify for some of their assistance, which will help you save on drug costs, doctor visits, etc. They probably even can help you get a good deal to set up these Part A, B, C, and Ds of Medicare or Medicaid. And really, I think C and D are the ones you pay for. And then, of course, there's AARP, valuable resource. Everybody that's over the age of 50 can use AARP and sign up to be a member, and you get discounts on a lot of stuff as well. But again, I just want to emphasize, do your due diligence. There's a lot of information out there that we don't know, and that I'm just touching on a tip of it here. This is like an iceberg. What you can see is nothing compared to what's underneath the water. So as I get more information and become more versed on it myself, I will share more videos with you if you folks would like. That being the case, leave me a like or a comment so I know that this is the kind of stuff you want to see, because I'm looking for this stuff anyway, but I'm not going to make videos if nobody wants to watch them. I want to make and give and provide information that you're looking for, as well as what I'm looking for. Okay, thanks for watching. We'll talk to you next time.